Good afternoon, and thank you for the opportunity for being here. I'm sure that most of you in your country, as in mine, you know that continuous medical education poses a series of problems, especially in the primary care setting, where the GPs have to know everything about almost every disease. So it's difficult to keep up with all the new data and the new guidelines and the new evidence. And when they go to medical conference, they always listen to boring stuff, but without any practicality. Okay? So it's difficult for them to go back and do something different regarding their patients. So what we think is that medical collaborative training and thinking is crucial to adequate performance in real-world situations, especially when in matters of life and death. Because in that second, what you know can save a person's life, and what you don't know, what you don't remember, will damage that patient, either causing death or causing permanent disability. So it's very important for everyone to know exactly what to do in an emergency setting. So when we think about classical training, it poses several challenges and several limitations. Because you don't have all the time in the world, you don't have enough patient availability, no one is eligible to take a cardiac arrest at this moment, right? So it's difficult for me to train a cardiac arrest without having one in front of me. Okay? And then you have patient safety issues. Because training must be done regarding patient safety. So you are not allowed to put a patient at risk in order for a physician to train something. That is definitely a limitation. And when you use models, they are usually passive and allow some limited interaction. So they don't express their signs and symptoms, they don't tell you if they are feeling better or worse, and that poses also challenges. Sometimes there's not enough focus on teamwork. So you have nurses working in one side and doctors working in the other side, and they don't connect. And sometimes teams are not used to train together and to train integrative approaches, especially in the patient that is critically ill. And when the time comes, that proves to be damaging to the patient, because if you don't act in a very coordinative way, things will go bad, and you don't want that. And when you have a model, you cannot play endless repeat. So you cannot train once and twice and 15 times or 60 times or 100 times. And that's one of the main issues regarding classical training. So what we did to solve this problem, can I have the next slide? Sorry. Is we tried, can I have the previous one? Yeah. So we know continuous medical education is crucial. You know that teamwork reinforces continuous medical education. We know that this should be broadly available. You know that model trainings can outperform training with real patients because you can train once and twice and all over again. But classical models lack interactivity and realism. So what we did... Sorry. Can I have the next slide? Good. So we use the multi-touch. They are ruining my surprise. We try to use multi-touch technology to create a very realistic healthcare environment, okay, in order to mimic a real patient situation, allowing voice and tactile interaction, and allow you to address a real clinical case from start to end. So you have clinical history and physical exam and labs and diagnosis and treatment and outcome, okay? So what we got was what we call iPatient. It's an innovative multi-touch platform with interactive 2D digital patient, with real-time vital signs and monitoring, with heart and lung auscultation. You can have fluid balance, you can have all the labs and all the imaging that you want. So you can address the patient from start to the end, and you can train communities, either emergency doctors and GPs, in approaching that situation and and treating the patient right. So now we can have the next slide, please. Okay, so we can have a full range of therapies. We can have patient voice response integrated. We can train either acute and chronic diseases. It's fully portable, so you can move it around, and it's easily updatable. And this is what we get. Okay, next slide, please. Please. Okay, can you pass the video? Okay, so this is our patient, okay? You can have the vital signs upstairs. You can have the therapy here. You can choose the therapy you want to administrate to the patient. You can see all the labs and exams that you wish in that patient, and you can choose the medication that you give to the patient. And once you give the medication, then the medication will take effect, and you are going to see an immediate change in vital signs regarding heart rate or blood pressure or oxygen saturation or whatever. You can see that you even have diuresis here, so you can monitor the fluid balance of your patient, okay? And the patient will have a voice interaction display. It will tell you if he's feeling better, if he's feeling worse, if his symptoms are waning or waxing, and you can have all sorts of interactions with the patient, okay? You can perform normal clinical history. You can ask all sorts of questions to the patient, and the patient will respond with small preset sentences, okay? You can edit the medication, and here you can have the medication for emergency setting or for a chronic setting, for cardiology or pneumology or gynecology or whatever specialty you want to make. And you can have a series of students or MDs or nurses or whichever healthcare professionals you want to train with this tool. And you can have it here in Maastricht and next day in Amsterdam or in whatever place you choose. Next slide, please. Okay, so we have trained more than 500 MDs in Portugal. We now have a nationwide program for disease awareness, and the results are quite amazing. You have 70% of people where we met their expectations, and we have 30% of people where we go beyond their expectations. Final slide, please. So our next steps is to develop new medical and surgical cases, to bring the project worldwide, and also to bring iPatient to new interface platforms like the iPhone or the iPad or the Android platforms or whatever, okay? And we really think that these sorts of tools can change patient education, can change medical training, and can improve the level of healthcare in your country, in my country, throughout the world. Thank you for your attention.